Many asks, "Dear doctor, do I have a migraine? Is every headache a migraine?" The answer is no. So what is migraine? Migraine is a primary headache syndrome of the brain. What causes migraine? Many researchers believe there is probably something called as a vasodilation in the brain, which means if there is a sudden gush of blood into the brain, if there is an expansion of the blood volume in the brain, and this leads to a symptomatic headache called migraine. What are the classical symptoms of migraine? Patients can have a headache which is most commonly unilateral, that is affecting one side of the head, but in rare occasions it can affect both sides. The classical photosensitivity under wherein the headache increases once they get exposed to bright lights or sunlight. Then phonophobia, wherein loud noises, earphones, when they're in crowded places, and music, loud music, this can trigger a headache, and that's when we think it could be migraine. Some people can even have visual disturbances when they are having an ongoing attack of this migraine headache, wherein they may have a simple blurred vision, or they may start seeing some shapes or some flashes of light in front of their eye. And this is called a visual aura of migraine. And most commonly, they have this nausea, or they even end up vomiting with this headache. Not all headache could be a migraine headache. So what is the important test to diagnose someone is having migraine? It's by doing a brain scan, a simple CT scan of the brain, or an MRI of the brain. But please make sure you get a brain scan done under the supervision of your neurologist and prove that the brain has nothing else in it and it is only a migraine headache. How do we prevent a migraine headache? The first most important thing is sleep. 7 to 8 hours of sound sleep is mandatory on night, in especially people who are having a migraine. Don't get exposed to toxic smells, natural oils. I would want to re-emphasize this. Natural oils like eucalyptus oils, all these balms that we use. How do we treat migraine? Is a migraine treatable or not, doctor? Is what many people ask. Migraine is treatable, but then some migraine can only be controlled and not fully treated. There are many drugs in the market now to treat and control migraine. In fact, very recently, FDA has approved certain monoclonal antibodies. They are injectable shots that we give patients with intractable migraine, wherein they take injections once a month and they are headache-free, say after about 10 to 12 injections, taken over a period of 1 year or so. So dear friends, the take-home message to all of you should be, not every headache is a migraine. Please visit your doctor and make sure your brain scan is done if you're having a headache for a long time. Prevention of migraine by a healthy lifestyle is very important. And treatment of migraine is well advanced and many options are there. Thank you.